This is Katie Sturgill on behalf of the League of Women Voters for Kittitas County, and we're interviewing today Bob Davis on behalf of the Hospital District 1 Commissioner Board Position 2. Bob, welcome and thank you for joining us. Could you please give your opening statement?
Yes, thank you. I appreciate the opportunity to share some of my thoughts and feelings about rural health and our hospital and our community. Bob Davis. I have lived in Ellensburg for 27 years. We moved here in 1998. Yeah, 27 years. Optometrist. I'm one of the owners of Valley Vision Associates here at the West Interchange. As I came here 27 years ago, came from the military. I was in the military about 9.5 years total. Last 3.5 years, I was a captain in the Air Force. So I switched from Army to the Air Force, where I was an officer. I have my master's in business administration with a healthcare emphasis. I feel like I'm tooled pretty well to understand to understand the background of rural healthcare.
Thank you very much. Appreciate that answer. And moving on, we have question one. What do you hope to accomplish as a commissioner?
Yeah, this is what we've tried to do from the beginning when I was first appointed and then voted into the commissioner position is really pretty simple: to increase access. So access, when I first came to town, was really hard to get a primary care doc or any kind of provider, and want to continue to develop providers that want to stay here in Ellensburg, that's committed to Ellensburg, that is willing to serve in Ellensburg. Our biggest challenge is, the balance between rural healthcare against bigger hospitals, reimbursements, government policy, because we are a critical access hospital, which what keeps us going is Medicare helps us out and helps to balance out some of our budgets. Access, people, it's easy to talk about access, but really you want sustainable access. You want providers to stay here, be a long-term caregiver, and to the point where you form, tighter relationships with your providers and
Thank you
better
very
care
much.
overall.
Perfect. That's an excellent answer. Okay. Question number two. In your view, what is the biggest challenge facing our rural hospital in the next 5 years, and how would you address it? And you mentioned access. Do you want to speak further on that or another
Yeah,
discussion?
yeah, you bet. The
Please.
biggest challenge is access. I mean, it's all comes around, how do we get people in to be seen by their provider? When I was first put on the board in 2016, the hospital had 50,000 medical visits. This year, we're going to have over 100,000 medical visits, so it's almost doubled. Labs, in 2016, we had 190,000 labs drawn. This year, we're going to have 285,000 labs drawn. The hospital employees, in 2016, there was 487 employees. We're almost at 700 staff members currently. Right. So our hospital has changed, has grown. We've been able to grow with the change as far as having more providers come to the area, more specialized providers. Right. I never thought our county would have cardiology, vascular surgery. These are things that we always hope for, but we have that, and people love to be able to get healthcare in their community.
And that is time. Thank you very much. Your next question. What are your areas of expertise, experience, or specialization that you think would benefit the hospital board?
Hmm. Yeah, good question. Um, so, um, as far as providing what I do as far as my job, seeing patients as an optometrist, is different than being a member of the board. I do have my master's in business administration with a healthcare emphasis. I did serve on the Washington Rural Health Association board for 6 years. I served at the Washington State Optometry Board for 6 years. I, with several other people, we started the free clinic here in town, the Open Door Free Clinic, back in 1999. Access is so important. I think if we can kind of build providers that really want to be here, want to serve in the community, have that vested position, it just makes our community a better place.
Nice, nice. Thank you very much. And last but definitely not least, thank you very much for joining us. Please give us an overall statement of, you know, who you are, what you're applying for, and what we would need to know.
Yeah. Again, um, I'm Bob Davis. I'm seeking reelection to Hospital District 1, Kittitas Valley Healthcare Position 2. Um, I have served in that capacity for just over 9 years. Hope to serve several more years. Um, Number one thing I would say is the emphasis on transparency in the community. Let people know what we're actually doing. We can be doing some amazing stuff, but if you don't let people know what you're doing, they think you're just kind of pushing along. But I think the hospital is amazing, doing a lot of stuff behind the scenes that a lot of folks don't realize. Access of patient care, even long-term um, access. We want quality providers for our community and for our citizens in Kittitas County.
Thank you so very much. We really appreciate your time and thank you for taking the time to meet with us today. Have a wonderful day. I'm going to go ahead and stop the recording now.